Okay. Camera's working this time. Just gotta make sure. Okay, so for my opening procedures, I'm going to check my chart, check the 5 rights if there is any drug administration. I'm going to perform hand hygiene. I am going to gather all my materials, and that is all. So instead, I'm going to take your axillary temperature. Okay, so I'm gonna walk into the room. Knock, knock, knock. Hi, I'm Brooklyn. I'm gonna be your nurse. I was just wondering if you could give me your full name and date of birth.
Mary Smith, December 12th, 1958.
Okay, and then can I check your wristband to make sure all that information is correct? All right, all looks good. So I'm going to now raise your bed to a comfortable height. And so today we're gonna do a head to toe assessment. It's only gonna take between 20 to 30 minutes. It's just to check that you're all healthy, to get your baseline information, everyth's all good. And so now I'm gonna get started with all your vitals. So I'm gonna take your blood pressure, check your oxygen levels. So let me put on my gloves, just for good measures. Where's the window? There we go. Good. All right. So I'm going to start out with your O2 levels. So I'm just going to put this on your finger. And I am going to take your temperature at the same time. So I'm going to put this little thing on it, and I'm just going to take your axillary temperature if that's okay with you. So I'm just going to stick it in here. You can leave it. Okay. And so I know that your O2 levels are good. Your pulse is at a 55. So that is all good there. And now I'm going to take your blood pressure. Oh. L. All right, your temperature is just fine. Everything is looking good there. And so I'm going to take your blood pressure. Thank you for rolling up your sleeve for me.
You're welcome.
Make sure that my camera's still rolling.
It is.
And so I'm going to just find your brachial pulse here. Not brachial.
Mm-hmm.
It is? Yeah, okay. And so now I'm going to take your blood pressure, if you don't mind me sitting on the bed here with you.
That's fine.
Okay. Your blood pressure is at a 175, which is good. It's pretty normal. And so now I'm going to take your pulse, check your pulse, if you don't mind. All right. All right, so your pulse is at a 60 and your respiratory rate is at 20, which is pretty normal. Okay, so as for pain, on a scale from 1 to 10, 1 being no pain, 10 being the worst pain you've ever felt, what do you feel on that scale?
1. I don't have any pain today.
Okay, so you have no pain.
No pain.
Okay, so now that I know that you have no pain, we're all good there. So can you smile for me? Can you frown? Raise your eyebrows? Stick out your tongue? Everything looks good. Can you tell me your name?
Mary.
Can you tell me where you are?
I'm in the hospital.
Can you tell me who the President of the United States is?
Mr. Joe Biden.
And can you tell me today's date?
September 9th.
All right. So now that I know that you're awake and alert, can you press against my hands? All right. Can you squeeze my fingers? All right. Can you point your toes? Bring them back. All right. Can you lift up your legs? All right. The other one. Looks good. Can you lift up your arms? All right. That looks good. Okay. So can you close your eyes for me? Can you tell me which hand I'm touching? All right, what about now? All right, and can you tell me what I'm touching now? And what about now? All right, that looks good. And have you felt any numbness or weakness or tingling recently?
No.
All right, so you're all good there. So I'm going to check your head for any abnormalities. That's okay. And I'm going to palpate your sinuses. Are you feeling any tenderness in your sinuses?
No.
No tenderness. Okay, then you're all good there. So I'm going to check your eyes. I'm going to use my pen light. So if I could have, I'm just going to look at them. And if I could have you follow with just your eyes, keep your head still. And if you could follow it in and out. All right. Just going to check that your pupils are all good. So if you could just look at one spot in the room, just look straight at it while I do this. Be great. All right. Everything is all good there. Do you wear any glasses or contacts?
Yes.
All right. So now I'm going to check your ear. Looks all good. Do you feel any pain here?
No.
Any pain here?
No.
Any pain here?
No.
Any here?
Nope.
All right. You're all good there. Okay, I'm going to check your mouth. So I'm going to use my pen light again. If you could open your mouth for me. Can you lift up your head a little bit? Okay, I'm checking for any missing or broken teeth, anything unusual in the gums or the tongue. Checking your throat at the same time. Everything looks all good. Have you felt any changes in anything?
No, not recently.
No soreness of your throat or anything?
Nope.
All right. I'm going to check your nose. Just really fast. Okay. Everything looks all good. Could you blow out of one nose? Okay, the other. All right, everything sounds good there. As for your ears, do you wear a hearing aid?
No.
Okay. And so, have you smelled anything unusual?
No.
Okay, you're all good there. So I'm going to look at your neck. I'm going to assess for JVD. And I'm going to feel for your lymph nodes. Carotid pulse. That's all good there. Can you move your neck around for me? All right. So your range of motion is all good. And so now I'm going to move on, check your heart sounds, if that's okay with you. If I could have you just sit up. And then is it okay if I sit on the bed with you again?
Absolutely.
All right. So I'm going to start
Through
here.
my sweatshirt.
It'll be okay.
Okay. I do have a shirt on under.
You can take in a deep breath. Everything sounds good there. And can I check your radial pulse? Both of them? Okay, they both feel good. If you could put your legs out again for me. Feel your pedal pulse. All right, they both feel good. So I know that all that is good. Can I have your finger free for you, for me. All right, your capillary refill is all good. All right, do you mind if I check your chest?
Go for it.
All right. No sign of any barrel chest. Can write that down. Everything is all good here. Do you by chance have any chest pain?
Nope.
All right, so then that's all good. Good to know. All right, so now I'm going to check your breathing sounds if that's okay.
That's fine.
If I could just have you sit here on the side of the bed for me.
Do you want me to face this way?
It doesn't matter.
Okay.
So I'm gonna have to do the front and back anyways.
Okay. Do you want me to take my sweatshirt off?
Oh no, it's okay.
Okay.
I was able to hear your heart just fine.
Okay.
All right. If I could have you take a deep breath in and out. In. Out. In. Out. In. Out. In. Out. In. Out. In. And out. In. Out. In. And out. In. And out. And if you wouldn't mind if I just look on your armpit here for a second, could I have you breathe in and out, in, and out, in, and out, and in, and out. All right, I'm just gonna move on to the front here. If I could have you take a big deep breath in and out, in, out, in, and 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 out, in, out, in, out, and then could I check under this arm, please? All right, can I have you breathe in, out, in, out, in, out, and one more time. All right, your lungs sound good. Okay, so all of that is all good. If I could have you lay back down. All right. So I can tell that the rise and fall of your chest is good. So your breathing is all good. And have you felt any shortness of breath recently?
No.
All right, that's good. And so I'm just going to check for symmetry here. I'm just going to feel your chest again. That's okay with you?
Yes.
All right. Everything is all good there. Okay, I'm going to have you lay down if that's okay.
Like down now?
Yeah, lay on your back. Perfect. I'm going to check your GI, make sure everything's all good, that I can hear some good stomach sounds. That would be
Should be some good stomach sounds for you.
some good ones.
Yeah.
Okay. I'm just gonna sit next to you here if that's okay. You can put your arm down. Okay. Okay, I'm just gonna start here. Some good ones.
Is it bubbling?
All right, got some good gurgles in it. All right, and I'm going to just right there. So you don't feel any pain.
No.
When was your last bowel movement?
A few hours ago.
All right. And have you experienced any nausea or vomiting recently?
No.
Okay. And so next I would normally check your urinary and all that stuff, but since it's not appropriate, I'm just gonna ask, when was the last time you peed?
Probably 30 minutes ago.
Okay. And have you had any changes in color or any burning?
No.
Okay. So I'm just gonna check that your range of motion is all good. So if I could just have you sit back up.
It's a lot of tasking old lady to do.
No, sorry. Can't move the bed. Okay, so I just want to check. Can you move your arms in a circle? All right. Can you do your legs too?
Like one at a time.
Yeah. All right. Your range of motion looks pretty good. Have you had any difficulty moving?
No.
Okay. And so I'm just gonna check your skin, make sure everything is all good. And so I'm just gonna check your skin for any trigger in case you might be dehydrated. Well, you are very hydrated. You look good. Your skin color is all good. Can I check your hair and nails? Nails are looking
Pretty
good.
healthy.
I love the colors.
Thank you.
Your hair is looking healthy.
Good.
It looks good. You haven't had any recent surgeries, so you have no wounds on your body that I have seen, no lacerations or anything.
Nope.
And have you noticed any skin breakdown?
No.
No. Okay. So that is all. So I'm going to lower your bed back. And here's your call light if you need me. So do you have any further questions?
Not at this time.
Okay. I'm just gonna make sure that I take all my stuff, that your area is clean. So thank you for letting me help. Thank you for letting me do this. And I will be back in about 30 minutes to come and check on you. Anything else that you might need?
No.
Okay.
Not today.
Awesome. I think I'm done.
I think you did great.
So after the fact, I have realized that I forgot to do a hearing test, but I think everything else I got.